love to welcome Sharon Stout-Shaffer and Christina Nyirati, who are joining us today from Heritage University.
Thank you very much. It's a pleasure to be here. I'm Sharon Stout-Shaffer, and I'm here to represent and talk about the program that Dr. Christina Nyirati started at Heritage University. And I'm really honored to be here. Heritage University is a small university in Eastern Washington. It is located near the Yakama Nation, and it's named for the tribes of the Confederated Tribes of the Yakama Nation. And the population of students at Heritage are primarily Native American, Hispanic, and first generation nurses. And this is Mount Adams, which for the Yakima people is Pahto. It is a sacred mountain. And if you would, for a moment, please just take 2 or 3 deep breaths and really look at this view, look at this mountain. It is sacred. And as you breathe and just drop your shoulders, relax a little bit, imagine that this sacred mountain represents the power, the presence, and the heights that nursing education can reach when it's fully grounded on nursing theory and nursing knowledge and integrated with our current biomedical system of training, because most of what we're doing right now is a very biomedical. And what I'm going to be talking about today is the curriculum at Heritage that's grounded on Chin and Kramer's work of the fundamental patterns of knowing that came from Carper, and then so you have fundamental patterns of knowing in the Amanda Fine. I have been teaching in curricula for a long time, about 30 years, and
yeah, I'll be glad to talk until Sharon's able to rejoin us. So to go back here, I just wanted to reiterate, we are on the Yakama Nation Reservation, the Confederated Tribes of the Yakama people. And we actually were invited. Before I came, I would always have to say that I was an uninvited guest. But one of the Yakama elder women asked if we could please come and establish a baccalaureate nursing program on the Yakama Nation Reservation. This young gentleman is actually a man who is not a Yakama. He is a member of Miami of Ohio tribe that's it's unrecognized by the federal government. He wanted to come to Heritage because he wanted to see how he could integrate principles of Native American culture with his nursing practice. Every year, the sophomores, after the sophomore year of nursing school, award the Fundamental Patterns of Knowing Nursing award to one of their classmates. And they picked Jared to give that award to. And this is him in our Early Childhood Learning Center, giving nursing care over in the Early Childhood Learning Center. They were preparing the preschoolers. And the last presentation, Delynn, really resonated with me because our students spend a lot of time trying to decrease the fears of our toddlers and their parents.
Well, I think the whole conference, there's been a lot of discussion on why we need to rethink some of what we're doing in undergraduate nursing education. And I would just say yesterday's program on the need to develop obligated courage in our students, helping students to find their voice, assuming positions of leadership and political engagement, and really developing emancipated leaders is something that I think has been on the mind of all of us for a long time. So the program was established in 2015. There had been an existing program before, and Christina was invited and went to develop the program and worked for quite a while. And the basic assumptions of the program, and I really see this in just the few programs that I've been teaching, is that nursing, the intent is that the students really develop the mental model that nursing is a discipline separate from medicine, with its own epistemology, its own knowledge base, and that students really understand the profession of nursing and the independent practice of nursing and what that means. And that the fundamental patterns of knowing are foundational to this curriculum, and that they not only learn deeply what these patterns are and how to really, I would say, embody personal knowing, ethical knowing. They don't learn about it, they learn it at a very deep level, and that is pulled all the way through the curriculum. This is a model that I had used before because I had developed undergraduate or graduate program in holistic nursing, and as a way to try to help explain to graduate students the difference in what that course was about and what we usually teach. I would talk to them about the biomedical model and what we had learned about, and how much of what we learn is focused on the biomedical model versus the unitary paradigm, where we really help people to identify and learn intuitive pattern recognitions, develop personal, emotional, and social knowledge that's context-based, to understand what healing is, to experience healing, and to support healing, to understand the energetics of thoughts and emotions, and how those affect our therapeutic use of self, and caring from the relational aspect of caring and what that means, as opposed to doing for. So this is a model that I had used before, and I would just, it was very effective. And with graduate students, I actually had graduate students sometimes that would cry when they would, and we would go into a lot of theories, and they would just say that it's really helped me to return to and understand what nursing is about. But teaching in this program around the themes and there are four fundamental, the four fundamental patterns of knowing are taught at entry level, pre-nursing. They're taught to freshman and sophomore nursing students. So they're at the very beginning of the program where they're learning the program. And I see it as what Christina has done is really developed and is planting a seed, and is really begun to nurture a whole new way of teaching nurses. So the courses I have taught in personally are personal knowledge development and ethics. The personal knowledge development is viewed as a precondition for establishing therapeutic relationships. It focuses a lot on self-awareness, self-reflection, meta-reflection, developing intentional action, use of self as a therapeutic agent, being able to be present to self, being present to other. And we do talk about stress and resilience, and they look at and measure their own stress levels and develop plans to develop their resilience. There's a lot of journal writing. The class is very reflective with a lot of journal writing. It's a writing intensive course. And so they write in their journals weekly, and then there are weekly papers that are deeply reflective. And they write stories and learn about the need to share and write stories. We also cover a lot of theorists and go into nursing history and cover the fact, the idea and the reality that nursing has its own epistemology and what that means. So it's a very powerful semester-long course that and students do use a lot of mindfulness and learn mindfulness as a way not to be mindful, as a way to really develop their sense of the process of personal knowing, to touch in with and become more authentic in their relationships and in their connection, not only with themselves, but with their patients, with their clients. These are some of the theorists that we cover in that course. We talk about Watson. And one thing that we try to point out to students is that many of the theorists, or if not all of them, in one way or another, talk about self-awareness, personal knowing, therapeutic relationships as being really important to nursing and to healing. They read Carper's original work, they read Chin and Kramer's work, use that as a textbook. We talk about existentialism. They read Nightingale and discuss what Nightingale brings to them and their understanding of what nursing is based on that. Peplau talked about Newman and a number of other theories that we were able to cover in that course. So it's a very rich course focused on theory. From my standpoint, I have taught mindfulness also for many years, and it's really having this whole course dedicated to helping students develop their understanding of what is the process of knowing myself as a person, of continually reflecting, of continually questioning what I'm about. Am I authentic? Am I doing what I do? Do I know what I do? And do I do what I know? Those questions really forms a whole mindset for them as they move into the rest of their program. There is a course in the aesthetics of nursing practice, and that deals very much with the creative arts. I have not taught in this course, but it does receive credit. Students receive credit at the university. They receive theater credit. It's very much founded on the performing arts, and they learn about the use of their body, the use of their voice, the use of the way they move as part of the art of nursing, and how that is related to and integrates with their personal knowing. And students talk about what a difference it makes to learn about the art of nursing and how to really think of nursing as an art act. This is from one of the student papers. I had so many quotes I wanted to share with you, but this is one paper. This is a student in the personal knowing class. Once I learned art is a part of nursing, it made me change the way I look at nursing. Afterwards, I was able to see how nurses imply art with their nursing care. I thought it was amazing. As I reflect back on this semester, I realize how much I've changed as a person. I feel like many of the theories and concepts I've learned can apply to my everyday life. With personal knowing, aesthetics, mindfulness, and becoming authentically present, I will begin to claim the discipline of nursing as my own. And they do that, and they talk about that. The other thing that Christina had students do, and because a lot of these students are Native American, is she has them and Hispanic, has them talk about their cultural background in healing and really bring that forward and discuss what they learned in their cultural background and how that influences their understanding of these concepts. So it's a these courses are very powerful. Ethics, right now I'm teaching ethics. We're about halfway through the semester, and this has been an amazing course. They really, by the end of this course, I believe they will be showing that they can comport themselves more ethically and be more aware, self-aware of that, and more intentional. We really focus on the social policy statement, what that means, and students really take that in and really absorb the fact that there is a social mission to their work as nurses, and how important that is and what that means to them personally. We cover in depth the Code of Ethics. We covered the National Student Nursing Association Code of Ethics. We cover standards of practice. We've covered the deontology and utilitarian frameworks and other contemporary theories, and talk a lot about virtue ethics. And again, this is a class with a lot of reflective journaling. They do write reflections every week, and we do a lot of case studies. And so they are really grounded in ethics. And what happened this week in class is that some of the students started bringing up understanding better what they got in their personal knowing course by understanding some of the ethics. So they're beginning to integrate what they were getting from the aesthetic and from the personal knowing course with the ethics. And you can see this happening in class. This is one student. Moral courage is the courage to take action for moral reasons despite the risk of adverse consequences. To me, this means that as a nurse, it is our ethical duty to go beyond barriers. If we believe that a situation is not ethically correct, or if we believe that there is more that we can do, then we should do it without being afraid or told no to the possibility of rejection. We have to remember that we are patient advocates, and we're just now getting more and more into moral courage and what it takes to develop moral courage, and the self-awareness and what that requires for that. Okay, then Christina, you were talking about this young man. And I don't know if you were able to cover this, but I do not know this young man, but he was in a clinic. This is a picture of him in the clinic where they are with parents and children, helping to prepare the children and the families to go to their clinic visit, and learning there's theory grounded in this course, family theory. And it looks to me like some play theory and probably some role modeling theory that is grounded into this course. This is early, again, in their curriculum. These students in the program have 500 hours of community public health nursing within this whole curriculum, and this is the start of that. So then the empirics of nursing, and this is a typical course where students learn about theory. Now, they have been reading theory in all of the other courses. They've been reading theory, talking about theory, and not theory, I'm sorry, research. They've been reading research, both quantitative and qualitative research, before they get to the empirics course. But this is really about the empiric research the evidence-based practice and how to look at literature and more of a traditional empirics course. And Christina, is there anything you would like to say? Because I have not taught this course, but I know that students have been reading a lot of both qualitative and quantitative research, and we've talked about some of the research in the other courses. So
I suppose that the most important thing I would like to say is that these students, a lot of times, empirical courses and nursing research courses are saved until later on, second semester, junior or senior year. They actually take this course before their first clinical term so that they really know how to identify legitimate sources of knowledge and how to read them and how to use them. And
okay.
it's wonderful for them once they actually get into clinical practice if they've already had that foundation.
Okay. And before we go on to some of the higher division courses, there are, once it's been my experience just with the students that I've interacted with and talking with Christina over the years as she developed this program and listening to what she was doing, because I've been so thrilled with what she's developed here. There are some other things that are incorporated. They get really grounded in these understanding of self-awareness, self-reflection, and how critical that is, and tools to develop that, and tools to develop their resilience, and the ethics of care, and the art, and the empirics, and how all those relate together. In all of these courses, there is also a thread. We have community of scholars, and students have their communities that they go to. The class is divided up into groups of 3 or 4, and they are put into their community scholar groups each week for discussion about issues, for analyzing issues, for talking about ethical case studies, for sharing their experiences as they reflect on something. And they talk a lot about what that has meant to them in terms of developing a safe space to really test out their voice, to learn to be authentic with each other. And it's really beautiful to watch them develop this trust with these groups, which I think, I don't know, Christina, we haven't talked about this, but I think you're going to find that over time, this is a huge piece of the learning that they get that will support them in their ability to use their voice. And these communities are based on principles of policy and power, and the need to empower each other. There's also, again, I said, the tremendous amount of reflection that goes on, and an attitude of the faculty teaching these courses that they are really co-creating learning with the students. They are mentors. They may know more, but they know different things from the students, and they're really an attitude of being a guide, which these students seem to really respond to. So I have found those things extremely important as I've been working with these students. 307 is a course on policy, power, and politics, where they learn a lot about the emancipatory, knowing that pattern, professional responsibility to shape social policy. They talk about activism, how to be activists, revisit the social contract and social justice. And Christina, maybe you would like to talk some more about this course, since I have not taught in this course.
This is a senior level course, and the whole senior year is founded on emancipatory knowing as the foundational assumption for learning for the students. And so the very first thing that they do senior year is read about emancipatory knowing. What is it? And how does it provide for the foundation for transformation of community? We live, our campus on the Yakima Nation Reservation, you know, there's been colonization that has happened for a few hundred years, and the students begin understanding that this colonization is been responsible for the historical trauma that has faced the people, the Yakima Nation people all around them. And so they begin questioning this worldview that as white people, we have been able to come in and take the lands of the people and really impose our way of thinking about the world and our way of knowing about the world. So, you know, emancipatory knowing has its, it comes from a multiple perspectives. The first person I think who really used the word emancipatory was Freire, who was an educational philosopher. And then as we moved into the 20th century and we began thinking about ways of adopting critical theory to undo and to relearn, to unlearn and then to relearn what we know about how we must question what is just, who benefits, who suffers. And this is the foundation of this course. It is also the foundation for, can you move to the next slide, Sharon? For our other senior level courses, they take community-oriented nursing inquiry and community-oriented nursing practice. And that is it is the largest course in our curriculum. It has more credit hours than any of the other nursing courses. And it is also grounded on assumptions of emancipatory knowing. And the emphasis is on overcoming social determinants of poor health in vulnerable populations. We spend a lot of time reimagining what, you know, we use the traditional textbooks in public health nursing. And the other day I heard Lucinda Canty, I don't know if you're here, Lucinda, or not, but I remember you talking about looking at the maternity textbooks at what is written about people from different cultures as they have been imagined by white people. And what we have done in public health a lot of the times recently is to interpret what we know about people that we go take care of in public health environments, you know, based upon othering them. Like, you know, we're the model of what health and goodness is, and they are the model of whatever else is. And we have to fix that and make them just like us in order to bring health. So, you know, we really make an effort together to wade through what does it mean to reimagine what they're reading and learning about so that they can really promote health as is co-defined between themselves and the community that they, all of our students come, most of our students, 90% of our students come from this community that they wish to serve. So our seniors also take community-based collaborative action research where, and we have a wonderful Native American woman. She herself is not Yakima. She comes from the Rosebud Reservation. But she teaches, she's not a nurse. She is a dental hygienist, but she actually used emancipatory knowing in her doctoral dissertation, which was in dental hygiene education. Because anyway, she teaches about how emancipatory knowing undergirds their opportunities now to promote knowledge by co-defining what is important for health from the perspective of the communities that they serve. So the other thing I want to make a point of saying is that every semester that our students are in clinical, we actually have rubrics for evaluating how students integrate the fundamental patterns of knowing in nursing into their clinical practice. And the students are very reflective about that. They really understand what that means. I have had faculty, new faculty, and sometimes people who come in from other environments who say, well, students can't understand that gobbledygook. What does that even mean? I don't even understand it. And I tell them, well, you know, we teach this to them. It becomes their sacred value. It becomes their foundation of belief and their spiritual center as nurses. So that's basically all I wanted to say. Sharon, do you want to say something else?
Just that I believe you've really developed something very special, and you're building a new pathway for us, and I'm done. Thank you very much.
Okay, thank you. And there are lots of very, very positive comments. I'll just try to, you know, people are saying this is groundbreaking, you know, the art is so important, what you're doing is just transformational. Lucinda made a comment, this curriculum is so important for all students, but for students of color, it is critical.